Hi, welcome. It's me, Dr. Khaled Sadek. You're watching my fantastic YouTube channel on cysts and lipoma removal. If you're new to the channel, then welcome. We specialize in the treatment of cysts and lipomas. So if you have any questions about either of those, then you've come to the right place. Check out our videos on the procedures that we've carried out. And if anything there looks of interest to you, then please don't hesitate to contact us at lipomacyst.com. Our email address is contact@lipomacyst.com. So today we're holding a live chat, a global live chat, where I'll be taking questions as I do regularly on any health topic: men's health, women's health, cysts, skins, lipomas, and more pertinent to today's environment, the COVID-19 outbreak. We've also got a special guest who'll be joining us as well. So I want to welcome everybody. Also, reminder that if you haven't seen my latest release, go check that out after this live chat. We've got this rather large, cheesy volcanic eruption of a cyst. We've gone real deep trying to get that sac out. You'll also notice that I'm going to be trialing some kind of like audience participation, where I'm going to ask you, my kind viewers, to watch my videos and record your expressions on your phone while you're watching the pops, and then send those videos to me, and I'll make a montage, a compilation of everyone's reactions to the videos. What do you think of that? I hope you like that idea. So what you do is you film it, then drop me an email. I'll send you a link where you can put your file in, or you can email it directly. My email address, if you don't remember or you don't know by now, it's contact@lipomacyst.com. So what I want to do is I want to kick off by saying hello to everybody. I see we've got a lot of viewers, a lot of people typing up stuff. So let's just quickly say hello. So it's Rusty, how are you doing? We've got Maria from Delaware. We've got Chris Baggio. We've got Pamela from Winston's. We've got Laura. We've got Anita. We've got Yvette, Paolo, Antonia from Mexico, Lisa from rural New York, Cookie from Jacksonville, Katina from New York, Corinne loves the videos, Marie loves the videos, Karen loves the videos, Denise and everyone is loving the videos. So let me know what you want me to. How do we stay safe given what's going on? If you haven't seen my video on hand washing, how to really kind of wash your hands properly to make sure there's no virus left in the hands, because we all know that this virus lives on the skin, and then when you touch your face, it goes into your eyes, your nose, your mouth, straight into your lungs, and there it causes the respiratory problems. So you've got to wash your hands on a regular basis. If you haven't seen the video on washing your hands, do that. Now, a lot of my patients are very vulnerable. They've got a lot of comorbidities like diabetes and heart disease and blood pressure, or asthmatics or COPD, or they've got some lung emphysema. So you're really, really high risk. And I've got a video on shielding and vulnerable patients and social distancing. So if you haven't seen those, go and check that out as well. So let's take some more messages from the floor. So Rusty's from Rhode Island. Claire, question: can blackheads come back after they've been cleaned out? It's a good question. I always say when I'm consenting patients, nothing is guaranteed in life other than tax and death, and blackheads can certainly come back. Alan from New Zealand, it's a bit different. The dog has a big mole on the skin. What can I do to help? Well, I would probably contact a vet, because they will know. They'll know more about skin disorders in animals. We've got Shah from Massachusetts. Lena says hello. Sherry from St. Louis. Corinne from Illinois. Kathy. Linda from Michigan. Hi, doctor, says Bridget. Excellent. Everyone around the world saying hello. So let's pick up some questions. Dr. S, my favorite live chat. Love the videos. That's Antonia from New Orleans. Fantastic. Lorraine says it's hard not to touch your face. You're absolutely right. So what I've noticed some people do is they put a band around their elbow, and it kind of restricts the flexion on the arms, so that when you come to kind of do that, you got this feedback, this pressure feedback, and you go, oh, I remember not to do that. So just tying a band around your arm, and so when you come to pull it, pull your arm back, trying to touch your face, you'll feel it, and then that will remind you, don't touch your face. Don't touch your face. It's nearly touch your face. Okay, so hopefully that's a little technique we can do. My hands are dried out from washing. Chris Badger. Yeah, so this is a problem. A lot of the alcohol that we use is 85%. It's hand sanitized, 85% alcohol. Really abrasive. Do something like a Dermal, a Citraben, or Aveeno, any of those hand creams, rub it in every time you wash your hands. Put back some of that oil to lock in that water that we lose when we wash it with soap. So what else? You and your videos are going to help us get through this. Gibby, that's my intention. I want to help you. I'm giving up my platform to just keep people sane while they are quarantined all over the world. So I'm going to be doing a lot more of these live chats. I'm going to do a lot more Corona videos. You know, the clinic is closed for the pops, but we're doing all the medical stuff. So I'm doing all the medical stuff. We're doing that, but we've got a lot of other stuff. So I wanted to produce the material. I've asked you all to kindly send in your reactions, and then we're going to have a massive jamboree. We're going to put those clips together, and we're going to have a great time quarantined globally, the Popaholic community. We're going to come together and we're going to make this happen. So let's see, so next some more questions. What specific kind of doctor do I need for a fist-sized lipoma? So that kind of a lipoma, Rusty, you come and see me. You come and see me. I'll do it for you. Alternatively, you must speak to your local practitioner and find out that kind of a size lipoma, you know, needs to be removed carefully. Okay. Let's have a look. I'm a nurse. That's Maria. She's wearing her PPE. That, if you don't know what PPE is, that's personal protection equipment. So gloves, gowns, head gears, glasses, face masks. So what is she saying? It gets so hot. We've been told only to change the things once. Yeah, so that is a problem. Now, the whole point of having PPE is it's what we call a fluid resistant surgical mask. So once it becomes damp, once it becomes wet, it's useless. It must be dried out because the virus is going to seep through that wet polystyrene layers of tissue. So you can't really wear it all day if it's soggy. So you might have to change it around. And remember, the virus can live on surfaces for up to 4 days. So you should have like 4 different what we call the fluid resistant surgical mask, and each day you rotate between them so that the virus works its way out and it's drying through as well. Okay, think of when the toilet paper. Susan says, hi, what's your opinion on videos where people are doing their own cysts? Some are really infected. Yeah, I think do not do that, because the instruments you have at home, they're not sharp enough, they're not clean enough, you don't know what you're doing, and it's probably just going to make it worse. And then when you come to see someone like me to do it for you, I'm going to have a much more difficult time to remove it. The scarring will be worse, the outcome will be worse. So do not do things at home, okay? Although it's very tempting. I know you guys are tempted to do it, but don't do it. So, Paulie, is it true that hand gel does not protect against coronavirus? Actually, it does. You have to get it at a virucidal concentration. That's 85% alcohol. And if you do that, boom, your hands are clean. They're good to go. Alcohol is there's a bleach. It'll just lice everything off. So, Marie, how can you blow your nose without touching your face? Well, if you do have to blow your nose, that's not a problem. But remember to wash your hands afterwards. You know, you can touch your face, but just wash your hands before and after you do so. Before we take any more questions, let's get my special guest. You all know her. You all seen her. If you haven't, it's Dr. Gumgums, aka Dr. Sarah from Perfect Smiles channel. She's my sister. She's an orthodontist. She's come in today to keep us all entertained. Take it away, Sarah.
Hi everyone, how are you? I've recognised a few faces, a few names online already. So hi to everyone. I'm here just to say a quick hello. I hope you're all keeping safe and well and sane during this isolation period. It's really difficult for us all, but I know we'll all get through it.
So Sarah, tell us, what is the best way to look after our teeth while in quarantine?
So top tips, you need a toothbrush, you need your fluoride toothpaste, mouthwash if you've got one, and keep up with that flossing as well. The main thing is you need to be brushing twice a day for 2 minutes. We need to keep tooth decay at bay. A lot of dental practices have closed at the moment, so my dental practice is closed to prevent the spread of COVID-19, and you really don't want to be heading out to your dentist during this time. So it's really important that you keep up with your brushing. Make sure you brush your teeth and your gums twice a day for 2 minutes every day. If you've got mouthwash, use mouthwash. If you're experiencing a little bit of gum inflammation, what you can do to help with that is just rinse with some warm salty water. This really does help with gum inflammation. It also helps if you're experiencing a sore throat.
Very, very good tip. So what I noticed, Dr. Sarah, is that when I go to the supermarket, they're always out of toothpaste. You know, what can people do if they're out of toothpaste? What toothpaste should they be using in quarantine?
So this is a tricky one. If you don't have toothpaste, if you've got bicarbonate of soda in your cupboard, then I would, as a last resort, this is very gently abrasive. It's actually less abrasive than normal toothpaste, but it is a little bit abrasive on your gums still, so you need to use it with caution. But if you have run out of toothpaste, this is something you could consider using. I wouldn't recommend it, but it's possible.
So okay, that's interesting. So that's very interesting, actually. So also when I go into the supermarket, there is a massive range of different toothpastes, whitening, sensitivity. Are they all the same, or are they actually doing something specific for each one?
So in terms of whitening toothpaste on the market in the UK...
You keep talking, I'm going to read the questions.
In the UK, it is slightly different to the US. So in the UK, whitening toothpastes have to contain, they contain a maximum limit of whitening product. And this limit isn't enough to whiten your teeth in the way that whitening gel from your dentist would whiten them. So the way that whitening products work that we can buy in the market, so at Boots or at your local drugstore, these are just abrasive. So that they will get rid of staining on your teeth, so staining from tea, coffee, smoking, red wine. They'll remove that sort of staining, but they won't whiten the natural colour of your teeth.
Okay, that's interesting. That's really interesting. Okay, and what makes a really good toothbrush? I know what makes really good equipment. I want them really fine and delicate and sharp so I can separate the tissues. What makes a really good toothbrush?
So a really good toothbrush is a toothbrush. You want something that's soft bristle. You don't want something that's hard, because that damages your gums and it can cause gum recession. And gums don't grow back once you've caused gum recession. That doesn't come back again. So you don't want a hard toothbrush that causes gum recession. You want one with soft bristles. You want one with a small head so that you can get around all the corners in your mouth. And really it's about the technique. Hi Lisa, really it's about the technique. So it's all about sort of angling. I've got a couple of videos on my YouTube channel as well about brushing, toothbrushing, and I've kind of diversified a little bit at the moment while I was in quarantine. So I've done a few other videos on baking and healthy teas. So if you're interested, do check it out. It's Perfect Smiles with Dr. Sarah Sadek. I'd love to hear from you. I know I've got lots of Dr. Sadek subscribers on there as well, and I love hearing from you all. You guys are just fantastic. You're the best.
So another quick question. If I chip a tooth, I know one of our viewers mentioned that her husband's tooth is wobbly and painful. What home remedies can we access under lock and key, under quarantine, if we can't get to a dentist? What home remedies can we do for toothache, for fractured teeth, for fillings that fall out, for teeth that fracture? What home remedies can we do, at home, if we can't get to a dentist?
So this is a really tricky one. It's something that dentists have been debating
I like to
a
give
lot.
you tricky questions.
This is a tricky question. It's been debated hugely online on all the dental forums, and the general consensus now is that if you're experiencing severe toothache, to take painkillers. I know it's tough and sometimes they don't always work, but you just have to keep taking the painkillers until the dentists are ready to get up and running again. Once they've got their PPE, currently there isn't,
What is the best painkiller you recommend? What kind of painkiller and what dose would you recommend? Like paracetamol?
Paracetamol, ibuprofen. Follow the instructions on the back. You don't want to, overdose, obviously. So you need to take the the recommended amount. You don't want to take too much.
What about any natural remedies? I remember when I had a toothache and I was on holiday, I couldn't access a dentist. I used like cloves. and just put on. And that seemed to help. What's the story there?
So cloves does have a slight analgesic effect as well, so it can have a slight numbing effect. So this can work as well as a temporary measure.
Very good. So there we go. Let's take some questions from the floor. I'm going to go right to the bottom. Can you recommend home remedy for scabies? Chris, sure. There are no home remedies for scabies. You've got to get some permethrin cream. You put it from your neck to your body. You put it in your hair. You leave it on overnight, and then you have a shower. What else? What's this? So I'm waiting for over 9 years for my 9-year-old son with Down syndrome to be seen. We can't get an X-ray. Like it looks like a baby tooth is sinking in. It's worried. So what do we do about development? What do you recommend for that?
Yeah, so was that Sam? Sorry, Sam. I don't know how old your son is.
9 years.
9 years old. 9 years old, and he's still got baby teeth. So that's a normal age to still have baby teeth at. So it might just be that the teeth are a little bit late at coming through. So what I would recommend is if he isn't able to tolerate the X-ray at the moment, just stay patient. Hopefully, you know, in a year or so, he'll be able to tolerate having an X-ray taken, and your dentist will be able to get a clearer picture of what's going on there.
Very good. Let's have a look. Some more of these fantastic questions. Do you recommend soaking toothbrushes in bleach? That's Kimberly Cook. What would be the thinking behind that? Like a peroxide mouthwash or something?
I'd say like an peroxide mouthwash, so peroxyl. If you want to soak it in that, then I'd say that'd be perfectly fine. Milton solution. It'd certainly get rid of some of the bacteria and get your toothbrush nice and clean.
So what about cleaning your toothbrush during the COVID outbreak?
So what you want to be sure of is that your
Bridget,
hi Bridget.
Yeah.
So you want to make sure that your toothbrush.
And the rain thing, that's a good question.
Yeah. So your toothbrush itself, depending on who you're sharing your house with, shouldn't be at risk. So, you know, it's in the bathroom by itself. The danger is cross-contamination. It's unlikely that if you're keeping your toothbrush by itself...
so toothbrushes should have like social distancing?
I would say definitely...
Like a 2-meter social distancing?
Social distancing between toothbrushes for sure.
There we go, Mr. Schumacher. You have to have social distancing between your toothbrushes. Okay, let's have a next question. Should I start a family during the outbreak? We're wanting a family. Joe, I think, you know, there's no time better than the present. It's personal preference. You crack on. Tina, Dr. Sadek, Dr. Khaled, I hope you and your family are staying safe. Tina, we're staying safe. I hope everyone out there is staying safe. Look after yourselves. If you've got any questions, message me on Twitter, message me on YouTube, message me on Instagram, email me at contact@lipomacyst.com. Let's have a look. Hey guys, I've been thinking about people who vape and the virus-borne droplets. Would these individuals be spreading the virus? Absolutely. I mean, any aerosol procedure will do that. Yeah, so keep away from those clouds of vapors. So we did Michelle's question on the loose tooth. Let's have a look. Let's go to the bottom. We're going to get lost all these questions. Hey, Dr. Sadek, I've already made a video of me. Hey, that's Deborah, of you watching a cyst pop. I love watching this reaction. Film it, email it, or email me, and I'll send you a link for the Dropbox where you can put your file. And hopefully by the end of the week, our little Popaholic global community will have our own sort of, you know, interaction between you, me, watching you, watching me, watching me, watching you, and we're all going to watch it together. So let's try and do that. Okay, so what else we got here? If two Americans were having this conversation, it would be so bloody boring. Just for your information. No, Antonio, that's not true. Americans are fantastic and they're just as entertaining. I love American stuff. I like you know, Saturday Night Live. I like Jay Leno, Alan, absolutely. Can you recommend home remedies for scabies? We've done that one. Okay, so it looks like no more questions coming in on the floor there. So stay safe, wash your hands. If you've got questions, let me know. Film yourself, filming the reaction, send it over to me as quickly as you can because I am jumping at the bit. I really want to edit this for you. So until then, everyone, take care, enjoy the videos. Remember to like, share, subscribe. Until next time. Bye-bye. Bye. Oh, and join her channel, Dr.
Oh, yeah, check it out.
Dr. Sarah, Perfect Smiles.
We'll put a link underneath. Bye. Take care, everyone. Bye.